All right. Hello, Balance Bosses. Welcome to our expert interview with the amazing Katrina Klein. She brings a wealth of knowledge to us tonight, talking about not just hygiene, but ergonomics. She is a certified ergonomics assessment specialist, which we're going to get into what that means and what she does. But beyond that, she's also a certified personal trainer and a competitive bodybuilder. So she kind of has a little bit of background in how our body works and the demands of dentistry and how that relates to how we operate in a healthy way. So thank you so much for being here, Katrina. I'm super excited for this interview.
Me too. Thank you for having me. I love it. I'm so excited to talk ergonomics and biomechanics. It's like to nerd out with somebody.
Yes, exactly. Well, and if anybody's watching, I see we have a couple of viewers, but if you have questions, throw them in the comments because we would definitely love to get to questions. But before we get started, tell us a little bit about your background, how you got into loving physical fitness and hygiene and how that evolved into where you are now.
So I've been in dentistry for 23 years, since I was 19. So I got in very early. I did notice a trend from the very beginning, of pain and dentistry, but I didn't really think a whole lot more of it than, boy, everybody in this field is hurting. Even though I wanted to become a hygienist, and apparently I was a glutton. But I've always been very fit too. I've been active, and so I started bodybuilding about 6 years ago, just over 6 years ago, and I noticed that my posture was better. I actually gained half of an inch of height.
Wow.
When you're only 5 foot and a half an inch, that's a big deal. So I can probably say I am 5'1", ladies and gentlemen.
Awesome.
But bodybuilding did that for me, and postural exercises did that for me.
Wow.
So I did this, and at the time when I was going through my competitions, and I had a coworker of mine. I just say it. It's no offense to anyone, but I always say she's a brand new baby hygienist. So she's only 2 years out of hygiene school. This poor girl, she was going to the chiropractor 1 or 2 times a week. She was in so much pain. And we became friends, and she said to me, I don't think I can do hygiene for another 2 years. I don't know what I'm going to do.
Wow.
And I didn't have pain, and I was in for 10 years at that point. So I said, well, why don't I take you to the gym? And so I took her to the gym, and within about 6 weeks of me training her, she didn't have pain anymore. She was just like, wow, I can actually work. I can see myself doing this forever. Like, I really think I can. And she's kind of the one that said, you have to share this with people. Like, you can't keep this to yourself. And so I said, really? You think people want to listen to me? I mean, I'm just a hygienist, right? I'm just a hygienist. And I bite my tongue for that every day because, just like anybody else, I had a special skill set. I had all this information. And so thanks to, what she told me, I went and I got my personal trainer certificate. And the more I fed this new passion of mine, the more it's grown. I decided I wanted to use my training from when I worked at Delta Dental, and I got ergonomics training 20 years ago, that I always used but didn't think a whole lot of. And just all the different types of training I've gotten over the years, it's been great. And I decided, well, heck, I could be an ergonomics person. So I went and did the schooling to get my certification, so I can say I'm a certified ergonomics assessment specialist, which is pretty cool, I guess.
Really cool. Really cool.
And so what that basically does is it makes it so I can watch somebody and look at their environment. Because what an ergonomics assessment specialist does is I watch the worker in their workplace. And so you're looking at it from a different lens. So for me, think about it like in dentistry, we look at people through the teeth lens. You look at people in their teeth all the time. You can't help it. As a hygienist, I can spot perio from across the room. You can't help it, right?
Right.
as an ergonomic specialist, I look at people and their posture all the time. So I look at how they sit or how they stand. And then if I see them in their work environment, I'm looking at the big picture and how I can make that workspace work for that individual. Because the reality is, not everybody has the same body. Not every operatory is the same.
Right.
Not every patient is the same. So we have to use different techniques with different people doing the same job. That's just the reality of it. So I took that, and I have a pretty thorough understanding of biomechanics because of the bodybuilding and the personal trainer certificate. Plus, I'm just kind of a really big nerd. Anything about the body is just super cool to me. So I live and breathe, biomechanics, fitness, nutrition, dentistry, ergonomics. That's what I do. I mean, it's probably good I'm not married, because then I would have to actually pay attention to that person too. So this is my marriage. Welcome to it.
Yeah. Well, and what a phenomenal thing that you bring to the world, because we were just discussing this before, but most of us get maybe an hour of ergonomics in school.
Yeah, it's really sad.
And yet it's something that can affect your longevity in your career and how you are treating your patients as well.
Right. Yeah, I mean, you figure an hour's worth of ergonomics, which is something that will certainly extend your career. You spent all this money, all this time, all this energy, because we all know that dental school is not a piece of cake. So or hygiene school, or, really, if you're putting your effort and your energy into developing this career, and let's face it, in school, you're just trying to learn a skill the best way you can. And then you get out of school and I need to do it quickly. I need to have this skill perfected in like 5 minutes. So that's not reality. You at some point something falls through the cracks, right? And the first thing to go is the thing you learn the least, which is your ergonomics. So for me, I see this all day long, because it's the first thing to go when you're thinking about production goals and you're thinking about perfecting your craft. And you're thinking about how you're going to educate this patient and get them to do the treatment that they so desperately need but don't value yet. It's kind of like I was telling you before, it's a trifecta of problems that we face between our emotional connection to the patient and our passion, and the physical labor that goes into it, and then the mental energy that it takes to do this job in the first place. And oh, by the way, can I bake you a cake? I mean, I just oh wait, ergonomics, what is that? How do I do that? So it's not an easy thing to do. Every one of us fail at it sometimes, but if you have somebody to remind you to practice at it or give you some instruction, how much easier would that be?
Right. So you actually go into the workplace and observe somebody.
Right. Yeah. So I do it in person. It is really cool. It's like having your own personal ergonomics coach right there with you. So that is so awesome. That makes me so happy. I don't know if we said that because it doesn't say the name, but that makes me super happy. Keep your elbows down. Yes, that's the first thing I usually tell people when I go in for an assessment. But yeah, I'll sit with them with a live patient. First, we set up their operatory. Let's move this. Let's move that. How do we want to set the operating stool? So how are you sitting on your chair? Hopefully a saddle. If not, then however you're sitting. Let's practice sitting. Let's practice standing. Things like that. And then they bring the patient in, and then it's cueing with the patient. Oh, put your arm here. Oh, move the patient head this way, or move the chair that way, or whatever. It's just one-on-one, individualized. My eyes are on you and your work, and it's amazing.
That is a gift, because that can radically change someone's life. Because someone can come to you, over the phone or a Zoom and say, I'm having back problems, I'm having shoulder problems, I'm having hip problems. But until you actually see their environment, like how the office is set up and how I mean, it's really, like you said, and every person, their body habitus is so different. So it really is individual.
It is. And now thanks to, our current digital situation, I'm doing them virtually. It's complicated because we have to have somebody holding the phone, on FaceTime or whatever to walk. I'll tell them walk over here, walk over there. But that saves the person, the expense of flying me out to wherever they are. If that's, so there's that option too.
That's nice.
So yeah, I mean, it can be complicated. You want to dedicate an assistant to standing with you for an hour or two. Well, if that's the hourly cost there is better than the cost of flying me out there, that's pretty nice.
Right.
And it's very convenient because then you can just go right back to your day.
Right.
And I think the best part to me, honestly, is that when I have somebody who's been practicing a really long time and they're experiencing pain and they know it, and I go in and I give them a tip or I have them do something different and they feel immediate differences, and the look on their face, I'm telling you, it's like a patient that walks in the door after 6 months and says, I started flossing, you're going to be so proud of me. It's the same feeling. You're just like, oh, yes. Because I know that person is going to be able to work as long as they want to without pain or lessen pain. Like, that is my jam.
I love it. I love it. It is so cool that this is your passion and you're able to really give it to so many people. I mean, there isn't probably a dental professional that isn't needing some improvement in their ergonomics, don't you think?
I think the majority of us do need it, yeah, in some way or another. I mean, I think that the word is getting out there. I know that ergonomics is a really big buzzword right now. People are finally starting to notice that there are solutions. In the forums, you're seeing people talk a lot about, weight training as being a good form of postural enhancement and things like that, that you don't have to be married to a chiropractor in order to be a dental professional, because that's treatment, And,
right.
and the reality is, when you look at this, we are prevention specialists, right? Why are we not preventing our own injury? Why are we doing the same thing over and over and expecting a different result?
Right.
It's, as Albert Einstein would say, it's insane.
Right.
So we're getting a lot more people with the message, and they're understanding that it's not just about buying a single piece of equipment. Equipment is important. Equipment is extremely important.
Yep.
But so is proper stretching. So is taking care of your body with strengthening and developing your posture muscles. So is practicing correctly. If I can go to the gym and weight train all day long, and if I go into the office room and I keep my arm up like this all day long, what am I doing?
Right.
Taking one step forward and two steps back.
Yep.
So it's a multifaceted issue with multi solutions, and if you just, it's like a sampler on a cheesecake. You just take a bite of each one, you'll be better off.
Now I'm hungry. Thanks a lot.
We'll say sugar-free cheesecake too. From the fitness person.
Right. That's why you love fitness, so you can have your cheesecake too, right?
Indeed.
So what would you say are the most common mistakes that we make as dental professionals? And because of those, what are some of the most common ailments that we experience? And what would you say?
So I would say probably the first and most common mistake is leaning forward and over a patient, rather than bringing your patient back. The first thing I do is, when I see somebody, 90% of the time, is put your patient down. Either they're too high up, or they're not reclined back far enough. And everybody, we know, like 70% of the people say, oh, I can't lean back, and I need a pillow that puts my chin on my chest, and whatever. I get those patients too, but you work through it. And what I do is, I tell my patients, well, okay, the chair's on autopilot, so I'm going to bring you back to where I need you and where it's set. And then if you're uncomfortable, I'll bring you up from there. And if you bring them up an inch, it's kind of like what they used to say, oh, bring them back an inch and then see if they're okay. Okay, I'm going to bring you back another inch. Is that okay? I'm going to bring you back a little more. No, do it the other way. bring them back as far as you need, and then bring them up from there. Because most often, after maybe 1 or 2, sometimes 3 adjustments, they'll say, oh, okay, that's much better.
Mm-hmm.
You know, so you've gotten so much further than you ever would have if you tried to adjust them from the top.
Right.
So there's that.
Mm-hmm.
Now, granted, there are people that can't. There are
Right.
wheelchair bound people. There are those rare exceptions.
Mm-hmm.
And what we need to do, this is the second mistake that we do in dentistry, we don't use our indirect vision.
Mm-hmm.
We don't. We need to eat, live, sleep, breathe, drink indirect vision. Because if we don't, what are we doing? We're craning our necks over and trying to get into somebody's mouth. It's such a simple thing to do, but you have to practice it.
Mm-hmm.
So one of the posts I did while we were all on shelter in place last year was, this is your opportunity. This is your chance to perfect your craft, get a shoebox, learn how to indirect vision again. You know, you're sitting at home anyway. So, you know, that, right? That's what we did in school anyway. We flipped something over and
Yep.
so yeah, you know, indirect vision, that's key.
Mm-hmm.
And then the next thing I would say is we don't take care of our bodies. You know, we just don't do it. We don't drink, we don't stretch, we don't weight train. You know, we just don't do it. We don't have time to pee. We don't want to take off the 25 layers of PPE in order to get to the water that's locked in our locker room or wherever.
Right.
We don't do it. And then we're maybe getting a lunch hour.
Mm-hmm.
And then we're running over at the end of the day. You know, I talk to dental professionals all day long. We go for 12 hours without a drink of water.
Oh, yeah.
As a bodybuilding competitor, I can tell you doing that is so bad. It's so bad.
Oh.
So we need to be drinking water.
Mm-hmm.
And there are solutions for that. You know, OSHA does not say in their regulations that in a sterile room where your room cannot be contaminated. So, you know, we clean our room, right? It's not contaminated any longer. We consider it clean.
Mm-hmm.
Otherwise, we wouldn't bring another patient in, right?
Right.
So the regulations say you can't put water in an operatory or a room that is contaminated. Okay, so in between a patient. The second regulation says, and I can get you the regulations because I have screenshots of them, is that you can't have water in an operatory in any area where you would have dental materials. So that covered in your operatory that has like brochures and, you know, extra pieces of equipment or whatever, that there's nothing you would ever get into. That's the place for your sealed water bottle that you can do in between a patient. You can take a drink in between a patient.
Yep.
And because they're vague in that way, it's up to the doctor or the owner to say, yes, you can, or no, you can't. Not every doctor is going to feel the same about that, but it's an option. You know, it's a conversation to be had.
Mm-hmm.
And we are 70% water folks.
Right. It's so important. And when you're dehydrated, you aren't functioning at your best mentally. And so why would your muscles be functioning at their best?
Well, not only that, not only do muscles, so your muscles will cramp up when you're dehydrated, but also dehydrated bones fracture.
Oh.
So imagine all these hours, it's cumulative, right? So all these hours that we're spending, we're compressing our discs in our spine, and we're dehydrating them on top of it. And we wonder why we all have blown out discs.
Mm-hmm.
You know, like give your body a fighting chance, folks.
Right. So simple. Just drink your water.
Yeah. You know, foam roll. Foam rollers are $25 on Amazon. You know, get one, do it for 60 seconds in the morning and 60 seconds when you get home at the end of the night. It feels like a deep tissue massage. It feels so good after you get through the first few where you're just like, it's like, it hurts so good kind of a feeling. After you get through that, it feels amazing. Mm-hmm. I have a client who said if she felt that my program, because I have a workout program that I give to dental professionals, she said, even if you didn't give me the workout program, learning about this foam roller was worth every penny I ever spent. Mm. So like that's huge, and it's $25. Yeah. So there's that. There's weight training. There's stretching throughout the day. I stretch with patients. Mm. How many of our patients are sitting all day? Right. Behind a computer. Yep. A lot.
Mm-hmm.
They're interested. They can benefit. You know, we talk about whole body health.
Yeah.
You know, our patients, how many patients come in with back pain?
Yeah.
Neck pain. Oh, I've been sitting at my computer every day. Oh, well, guess what? I've been sitting all day too. Let's stretch together.
Oh, I love that.
Right?
Yeah.
It's exciting.
I mean, what a way to deepen a relationship with the patient too. Like, oh my gosh, let's take a minute and stretch together.
Yeah. Well, we're waiting for doctor to do your exam.
Yep.
You know, or I'll just start doing it. You know, I'll just kind of grab the side of my neck and pull it over, and they'll be like, they'll give me a look like, what are you doing? And they'll be like, yeah, I'm just stretching my neck out. And I'm like, you know, you work at a computer, don't you? Yeah. Well, why don't you do it? I bet you it feels great for you. And they're like, oh, wow, I can't believe that. The things you learn at the dentist's office is what I hear all the time.
Right. Well, and it deepens that know, like, trust factor. And then they may be more able to accept your treatment recommendations because, oh, wow, she really cares about me as a person, right?
Yeah.
That's so cool.
Definitely involved with it because, like you said, if they trust you, they're more likely to say, yep, if you said it.
Mm-hmm.
So, plus pictures. Pictures are great.
Yeah.
So yeah, I would think those are the top 3 things that, you know, take care of your body, make sure you're using, you know, good equipment, and, you know, use ergonomic strategies when you learn your indirect vision, and put your patient down. Most of us are doing like this all day. And that's just problematic. If you wear your elbows up as your earrings, what's going to happen? It's going to sit like this after work, and then your neck is going to be, you know, take a breath.
Right. So what are some of the telltale hints right away that people should be watching for? Some things that are happening in their body that maybe, oh, something I need to pay attention here. Are there initial signs and symptoms that they should listen to?
Yes. So the first thing that we all start getting is fatigue. And you know, at the end of that day when you've gone home from work and you basically just want to sit down with a glass of wine and pretend that you don't have a family for 5 minutes or an hour or 3 if they'll let you. You know, if you're that wiped out at the end of your day, there's your sign. Dentistry is a physically demanding job, but it shouldn't wipe you out that much. Okay. Either you're overworking your machine, which is your body. This is your moneymaker, folks. So you can't abuse it. So you're either overworking it, you're not getting enough water, you're working it in the wrong ways, which is still overworking it, or you're not preparing for your day. I like to consider us dental athletes. So just like a track star doesn't go up to the line without the right shoes, the right training ahead of time, you know, the right attitude, the right nutritional everything. We can't walk into the operatory and think that we can do the same thing. You know, go in on 4 hours of sleep, throw your hair in a pony, and call it a day. It just doesn't work that way. It's too hard of a job. That's reality, right?
Right.
You would want your neurosurgeon to walk into you and cut open your brain with no sleep and not having enough hydration or nutrition or being, you know, fatigued to that point. So why would we do it any different?
Yep.
We have a big job.
That is that I love that thought. Like the pre-work is super important. And that is taking care of your machine.
Yeah. What you do for that 8-hour day of work is cumulative. Just like the injury that you get from doing it every day is cumulative. Which is why when you first get out of school, you're totally juiced and you're like, okay, I gotta pay off this $400,000 worth of student loans tomorrow. Here we go. I'm gonna do 14 crowns a day, and I'm gonna clean 16, you know, sets of teeth, and I'm gonna do all this stuff, and I'm gonna bonus, and I'm gonna be the best, you know, dental person ever. Okay, that's great when you first graduate and you're 25 and you have no injuries. But how long does it take you doing 6 days a week of dentistry to wreck your machine?
Yep.
Average burnout for hygiene is 7 to 10 years.
7 to 10 years. That's crazy.
And dentistry is not much more than that. I want to say 12 to 15, but I don't know the facts on that. But I think that's what I remember. So
Mhm.
So if I'm doing my math right, and I paid $300,000 for 15 years of dentistry, that's wow.
Yeah.
And most of us, and here's the crazy thing, dentists, 33% are retiring from disability, not because they want to.
Yep.
That's an astounding amount of people that can't work
Right.
when they want to.
Right.
And we have a
Right.
shortage.
And we have a shortage. And the other piece of it is how many are working in pain, and how is that affecting their performance, right?
Yeah.
For sure, it has to.
Oh, yeah, absolutely. I mean, think about it. Your 4 o'clock patient, you're resentful half the time that they walk in the door. Okay. How much are you really going to fight for them? How much energy are you really going to bring to that appointment when you know that it's going to run you past 5 o'clock for one, and you've got all the things going on. Your 8 o'clock patient and your 4 o'clock patient deserve the same you.
Mhm.
And how often does that happen? It
Yeah.
just doesn't, because you're fatigued, because you spent all day long killing your body. Your muscles are exhausted from holding you in the weirdest contortionist positions.
Yep.
And they're not meant to do that. That's just not how the body works. So staying in neutral posture is so essential to career longevity. If you start working in neutral posture, you can practically guarantee you're going to get a 25% rate. Think about it like that, because you can be that much more productive. You can sell that much more dentistry. You can be that much more valuable to your practice. It's just such a major difference in your life when you're working without pain and without being fatigued than when you are. I mean, I see it. And my clients will tell me, Katrina, this is crazy. I've been practicing dentistry all this time, and here I am now, and I now have a role. I can work till I don't want to. So different.
And the other piece of it is quality of life outside of the operatory.
Yeah.
Right?
Yeah, absolutely. Because this is a job, right?
Yeah.
This is a job. It's our career. We're passionate about it, but I don't live to work. I want to be able to go home and run a trail, or play with my kid, or go paddleboarding, or play with my dog, or do all the things, get around, roll on the floor, and act like a goofball. I don't know, whatever I want to do. If I've got little kids, if I couldn't get on the floor and play Lego with my little kids, I'd be devastated.
Right.
That's not cool.
Right. Right. And so, yeah, I think that's so important to think about, is just really quality of life, in and out of the op. And we want longevity. I mean, we're living longer and longer, and we want to be able to be active as long as we live as well, right?
Yeah, that's the goal, right?
Yeah.
You love your work, and your work is great for your home life. You want that work-life balance.
Yep.
Everyone's trying to achieve, especially after 2020. I think a lot of us have realized that we want to enjoy our families more. We want to enjoy our home life more, and that we don't have to be on the grind 24/7. And that's okay. But then when you're on that grind, you got to be really at your best.
Right.
Providing really good quality care, being your best to you, and taking care of you is part of that. Part of the leveling.
Yeah. So I'm curious how weight training plays a role here, and you discovered that sort of by accident.
Yeah.
But how is that important? Why is that such an important piece of this for us?
So the reason why weight training is important is because of muscle development, and because of the way that when we work, we don't work in neutral posture. We work out of neutral posture. We're hunched over. That's not normal. We're sitting. If we're sitting in a traditional stool, that's not normal. The back gets tweaked into all different kinds of positions. The lumbar spine gets straightened out. That's not normal. When that gets straightened out, the thoracic spine goes up, your head goes forward. I mean, there's a whole snowball effect of what's happening. And so what we need for muscle development of the postural muscles, which is our back muscles, our core muscles, the glutes, and the quads and hamstrings. I mean, it's the whole body, but you need your body to be strong in order to maintain neutral posture. Most of us get into neutral posture, but staying there is extremely difficult because we don't have the muscle development there to sustain it. And I love yoga and I love cardio and I love all those things, but they don't develop muscle. Resistance is required to tear muscle fibers in order to get muscle development. In order for those muscles to mend back together in multiples, it's like taking a thread, pulling it apart, it's puffy on both ends, and when you give it the protein and the nutrients that it needs, it comes back together, but it's bigger. But the best way that I can kind of describe it so it looks like a visual, so when that happens, the muscle gets bigger. You keep doing that and it gets bigger. You keep doing it, it gets bigger. Then all of a sudden, your body now can hold itself in muscle or in neutral posture because the development is there. Because now your body is used to it. And then there's also the question of correct form and how and what exercises we're doing and things like that. There's exercises we have no business doing because we already either overuse, overtax, or the exercises themselves are super high risk. So there's things that we don't want to do. There's things that we really want to focus on, like, for example, rows are a fabulous exercise. That's the first thing I tell people. Find something to pull at you. Pull towards you. That's a row. Bring it to your belly button in neutral posture. And that's going to help develop that neutral posture to stay there. So weight training is key. It's something that women in particular don't like to do. We feel oftentimes gym intimidation is what a lot of people call it, right?
Yes. Been there.
Yeah, me too. So my first gym membership.
You too? Even you felt it?
Yes.
Okay.
I'm going to tell you, when I got my first gym membership, just over 6 years ago, so it was 6 years in December. It was December of 2014.
Okay.
So wait, that was 7 years ago. When I got that membership, a friend drugged me inside because I sat out in the parking lot crying like a little girl because I thought that everybody was going to know that I didn't know what I was doing. I was terrified that people were going to watch me and laugh at me or say bad things about me because I was doing something wrong. And I sat out in that parking lot. I'm telling you, if it wasn't for that friend of mine that drugged me out of my car and into the gym and made me sign up and then made me go talk to a personal trainer who then became my bodybuilding coach. That's a whole other story. But if I hadn't have done that, I would be sitting here not, I was just as terrified as any other hygienist. And I remember saying to every patient and to my family and my friends, well, nobody can do hygiene forever. It's a guarantee that I'm going to get injured. And I'm a single mom, and I don't know what I'm going to do in 7 to 10 years. And I said that a lot until I found bodybuilding. And now I know I can do it until I don't want to.
That in of itself, I love that because it shows your vulnerability that so many of us feel. And it highlights the fact that we can make this change at any time.
Yeah, I was 35.
It's never too late to say, all right, I'm going to go to the gym. I'm going to figure this out. And I'm going to change my body, right?
Yeah. And that's why I do what I do with my workout program with clients. I give them literally everything. I mean, there is a paragraph with a video on every single movement that they do so they understand what they're doing, why they're doing it, how it feels, where their feet should be, the whole thing described so that they know they can just sit there and look at their phone and look at their document that they have for me, and everybody else might think they're scrolling Instagram, but they're knowing what they're doing while they're at the gym. And they have me in their pocket right there. So they know.
That's so cool. So yeah, let's focus on that because you have this, it's called ErgoFit Life workout program, right? And so explain, like, if someone's interested in this, how do they start this? What is it, and how do they get into it? What are the particulars of it?
So basically, they can either go to my website and pay for it. It's $100. Yeah, the website's down below. It's $700. It runs for 3 months. And I create a workout program specifically for them. So once they pay it, I send them a whole questionnaire. It's kind of like my version of a health history with more details. I get measurements, I get pictures, I get videos of them doing movements so that I can see where their dysfunction is. Mm-hmm. Because I'm a personal trainer, I know what to look for in that respect, but I also have all this other stuff and my experience being chairside. I know what hurts, when it hurts, and how it hurts. Mm-hmm. I've battled the lung, the cheek, the tip, or the tongue, and the lip. I've battled it all. I've had the patient you have to stand for. I've had them all, just like everybody else, right? Yep. So I know where they're coming from, and I know when they say this hurts or that hurts or this hurts, I understand why. And so not everybody has the same pain, and I create something specifically for them. That's awesome. And then I put it together, and it's either 2 or 3 or 4 workouts, whatever they want. Mm-hmm. And it lasts for 3 months. We have phone conversations every week to keep them accountable. Mm-hmm. I have a nutrition guide sheet that I give. I give them kind of a calorie bank per se, and then I teach them how to structure their meals. I don't do meal plans because I'm not a licensed dietitian. I don't want to do that. And I don't know what everybody likes to eat anyway. So why anybody would want to do that isn't a licensed dietitian is beyond me. But my goal is to teach people how to eat so that they can meet their goals. Mm-hmm. Weight-wise, because everybody has weight management that they want to do, whether it's to gain weight or to lose weight. Mm-hmm. And then, give them the workouts that are going to meet their needs. I have people that are not dental professionals that are clients, and they just they're athletes. I have a client right now that is a Spartan that wants to go I'm coaching him through his full Spartan season. Having that athleticism helps me in that respect. So it's custom. It's completely custom to what they need. And that way I give them the stretches they need. I give them the workday stretches they need. I give them everything they need. Mm-hmm. And then they have my cell phone and I'm available all the time.
That is amazing because I love the fact that it's custom because everybody's different. And so what's going to work for one person is not going to work for someone else. Mm-hmm. And I love the accountability. That is a steal of a deal. I think that because that can change somebody's life.
Right. Yeah.
Not just in their career, but their life.
Right. Yes. Well, and when you exercise regularly, you feel better. Mm-hmm. When you feel better, it rolls on into the rest of your life. It's a ripple effect, So, and I think the other thing is that, I've created home workouts. I've created, workouts for recent mommies and, all of that stuff. But I think what makes my program really different from a lot of people's program, apart from my unique perspective and that I'm gearing it towards their dysfunction, is very much corrective exercise oriented. Mm-hmm. What makes it different is that I don't say, on Monday you do this, on Tuesday you do that, on this day, I say day one. And if your day one starts on Wednesday, I don't care. Make it fit into your life because my goal is to keep you for 3 months, walk you through it, and let you go. Mm-hmm. I don't want people dependent upon me for the rest of their life unless they just want to do accountability coaching or have me create a new workout at some point or whatever. I mean, I've done multiple sessions. Some people really like that, and that's totally good by me, but I don't want anyone to feel like they have to. Mm-hmm. That, to me, I really want people to be able to take this information, teach them what they need so that they can do it on their own and feel super good about it. Because it feels good. When you're on your own and you're like, oh, I'm doing it, it's great. It's so great.
Right. It just makes you want to do more. It makes you want to keep it up. It makes you want to share it. It has a ripple effect, really, doesn't it?
It does. Yeah.
Awesome. Yeah. And so you also have an ergonomic assessment course. Tell me a little bit about that.
So I have a course that I teach. It's Ergonomics and Dentistry, and I teach it for the whole office, the whole dental team. Mm-hmm. And it's all kinds of just everything you can possibly imagine from, I talk about posture enhancement. I talk about equipment in the office, things that are truly ergonomic versus not ergonomic, different strategies that you can use, both for a hygienist and assistant. I even talk about things that front office staff have, because I started in the front office, so I know those struggles too. Mm-hmm. 23 years in dentistry can get you a lot.
That's awesome.
So it's a course that everybody in the dental office can learn something from. It's very interactive, so there's stretches that I teach throughout it. Mm-hmm. And that way they can take it and use it right then and there. Mm-hmm. And so, in fact, the stretch card that I give them, I'll give everyone here today that's listening. This is my gift to all of you. You can take it, laminate it, put it up in your operatories. And then you have something, you know, a bunch of stretches to choose from. I think there's 10 or 12 stretches, and just do one in between each patient. I mean, nice. It's great for just something, you know, to have. And I teach that. Yeah, it's really cool. A lot of people are like, oh, I still have those stretches up, and I haven't seen them in like 3 years. So, you know, it's unlike some of the courses where you take and you get super really excited about it, and then it kind of fades over time. So that makes my heart feel happy, you know.
Yes.
So that one is for the group. I teach it to study clubs. I teach it at, you know, association meetings. I have a version that I spoke for Dental Life around the world. I mean, that was really rad. So I got to do that.
Nice. And, so you can do that. You can do that virtually and live. Yeah. Nice. Nice.
Yeah, I've done it a few times on my own. But usually it's associations that will hire me to speak, or I'll have, you know, someone help me, a sponsor or something, help me to get it to an association. So yeah.
You know, I encourage anybody in the dental office that is conscious of how they feel and their bodies to reach out to Katrina, because this would be a wonderful thing to do as a team building course. It would be wonderful as a dentist to gift this to their team. It would be wonderful as a teammate to ask the dentist to, hey, let's do this together. I mean, because when you feel good, you do more good. And if you all feel good in the office and you're all watching and on the same page, like, hey, you should do that stretch right now, or someone complains about something. Hey, well, let's look at how you're sitting. We took that course. I remember what she said, right?
Yeah. Yeah, and I mean, the stretch can be used in morning huddle. I know offices that will take it and they'll do one stretch every morning. But, you know, even like what you were saying with like as the doctor gifting it, I've actually had doctors do that. They've told their staff, hey, listen, this year, instead of giving you, you know, a flower bouquet or whatever it was, you know, I'm going to do an assessment. I'm going to give each of you an assessment. So they get their, and I do a doctor assistant as a team, and then a hygienist, obviously solo. But, you know, I've had a lot of doctors do that. I've even had one doctor do it for their hygienist as an anniversary gift.
Oh, nice.
You know, they'd been there for 10 years or something, and so they said, hey, you know what? You know, you're always kind of complaining. Let's have Katrina come in and do this for you. So, I mean, wow, what a great gift, right?
Right.
I mean, needs another expensive watch or whatever.
Right. That really shows that you care about that person, their health and well-being, which is ultimately the greatest gift we have.
Right. Yeah. It was really cool. It was really cool. In fact, I even had one doctor give his hygienist the workout program as a gift. So I didn't go to the office, but I did get to work with other people.
Oh. So that I love every way that you are incorporating this. There's just lots of different ways to get in contact with you, to utilize your skill sets and improve our lives. So kudos to you for sharing this gift. And that very first person that you helped, kudos to them for saying, you've got to share this, right?
Yeah, thank you. I agree. I love her still. We're still good friends, and she will text me every once in a while. Hey, I need some motivation. So we'll talk and get back in the gym. And yeah. I'm here. I'm always online on Messenger, and you know, you can go through my website or message me on Facebook or Instagram or wherever. I'm always available. I'm always answering questions and equipment questions a lot of the time, you know, whether it be about saddle tools or loops or whatever. So I'm available.
Nice. Yeah, definitely check out her website because it's really a nice website. But what is really eye-opening is there is a picture of somebody who shows their back before they worked with you and after they worked with you.
Mm-hmm.
Blows me away.
Yeah. Isn't that incredible? Yeah. And that client only did 3 months with me.
Wow.
She just purchased one program. That's all she purchased. But she kept going. She was so happy. She was in such debilitating pain. She would have it for 12 weeks at a time.
Wow.
And and what's crazy is the reason why, this is why I love the ergonomics part of it. The reason why she was injured in that way, she was never in a car wreck. I mean, you should see the x-ray. I have a spinal x-ray of her that's incredible. But what happened to her was she worked as a right-handed hygienist in a left-handed room for 14 years.
Oh my goodness.
That's what happened to her. And her back looks like she had MS. I mean, it's completely broken. And her x-ray now is not a lot different, only now she doesn't have pain. Just by exercising. She had tried everything. She tried physical therapy. She tried getting surgery. Surgery wasn't doing anything. She tried chiropractic. Nobody could help her. She was at the end of her rope, and I'm always the Hail Mary. I'm always the Hail Mary because you talk to these people who are doctors, and they have all these licenses, and this is what everyone says. You need to go see a chiropractor or an osteopath or this or that or whatever. And why am I going to talk to this hygienist personal trainer? And when I first got her x-rays that were sent to me, I remember thinking, I really hope I can help her, because that was a really scary x-ray to see. It was really intense, and then it worked, and I was okay. I can do anything. If I can fix that woman, I can do anything.
Oh, I love it. Well, and it just goes to show like the fundamentals, how important the fundamentals are. And we search out all these crazy things to try and fix ourselves when if we would just look at the fundamentals and even starting them before we have pain, right?
Yeah. Oh, if I could get into the schools. I'm working on it. I'm telling you, I would love to get into schools so bad, and just let me have them just while they're little. Let me have them when they're brand new, so I can stand behind them in clinic and say, put your arm down.
And go to the gym and drink your water and make sure you're doing your pre-work, right?
Yeah. Prepare.
Yeah.
Prepare for the line.
Oh. Well, this has been awesome. I am so happy we brought you on. You are a wealth of knowledge and a gift to the world of dentistry. So
thank you so much. I appreciate that. I'm so glad to have gotten a chance to talk with you.
Yes, and so make sure and contact Katrina. Check out her website. She has so many ways to help you. We talked about her workout program. We talked about her ergonomic assessment course. And like she said, reach out to her and message her, ask her a question. She's here for you.
Yeah, absolutely.
All right. Anything else before we go tonight? Anything else that you'd want to mention or let us know about?
Honestly, I think the best thing I can say is, just like it's on an airplane, you got to take care of you before you can take care of others. So it does pay off, and it's worth it. And I know it's hard to get started, but just start. Even if it's just taking a walk around the block, just start. If you need accountability, even if it's not me, get a neighbor or a friend or somebody, because needing accountability in the beginning, there's nothing wrong with that.
No. Yeah, awesome. That's fantastic. Well, thank you so much for spending some time with us. And I'll make sure that everybody gets that stretching handout from you that is interested in it. And thank you for that gift. That's a beautiful gift to give too. So
Thank you. Yeah,
All
I'm
right,
happy.
balance bosses. Remember, you are the CEO of your life. Become the boss of your balance, and reach out to Katrina if you want some help. All right. Cheers, everyone.
Bye. Thank you.